Hi, and thanks for hitting the snooze button. I'm Neil Headley. I was prepared to write off a literal lifelong battle with insomnia to just being a part of doing more than 30 years of morning television and radio. It's just part of the gig, right? So I dug a little deeper, and it turned out there was way more to learn. In this series, we try to help people fix their sleep by figuring out why mine is so horribly broken, and maybe we can stumble upon some answers together. Quick note before we get into this week's show. Last week's superstar guest, Julie Flygar, was generous enough to give us copies of her terrific book to give away. It's called Wide Awake and Dreaming, My Journal of Narcolepsy. All you got to do to get your chance to win is head to our website, thesnoozebutton.com. Click on the contests link and do it before May the 31st, 2020 for your chance to win. Now, this week's episode sounds less like me doing research, or, as they say, all research is me search, by talking to a neuroscientist, and more like a couple of friends just geeking out over sleep science. I want to introduce you to my new friend, Dr. Seema Khosla. Sure, she's the medical director of the North Dakota Center for Sleep. She's board certified in internal medicine, pulmonary disease, critical care medicine, sleep medicine, and yes, she is the Consumer and Clinical Technology Committee chair with the American Academy of Sleep Medicine. But she's also the host of Talking Sleep, a brand new podcast from that same American Academy of Sleep Medicine. That show is a little bit like this one, except it's mostly sleep doctors like Seema talking to other sleep doctors. And as soon as I heard the show, I knew that we needed to have Seema on the Snooze Button podcast. So here she is. Seema, I start every episode of the show exactly the same way. Everybody gets the very same first question, and it is this. I'm going to put you on the spot. How did you sleep last night?
Oh, that's a great question. I actually slept really, really well. And part of that is because I didn't sleep well the night before. We have dogs, and they decided to get up like 3 times. And so last night I told my family, I'm going to bed, leave me alone. And they did. And I slept great. I think I woke up at like 9 o'clock this morning. It was wonderful.
Okay, so the dogs, let's see, this is what's going to happen on this show about 100 times already. I can tell just from the way this conversation has begun. Dogs, do they sleep in the bed or no?
So this is really funny. So mine do not, but I have 2 labs, and that would be really sort of ungainly to have these giant dogs in bed with me. They try. In fact, I usually have one in my office under my desk and one beside my desk. And I'm going to take a little detour. So a few weeks ago, we started doing telemedicine full time, and it was right before my kids went back to school. They'd been out for spring break. And so I'm seeing my last patient of the morning, who of course is a brand new patient. And right as I'm wrapping up with him, my kids had kind of decided this would be a really, really good time to bathe off the dogs. And so I'm trying to sort of end my visit with this patient. All of a sudden, I have 2 kids and 2 giant labs stampeding through the house, soaking wet. And I'm like, if it had been a patient that I already knew, they probably would have thought it was really funny for me to have this wet dog in my lap. But I'm not sure. I was very glad that I actually managed to end the visit before I had this giant dog. So in my lap. So yeah, it's funny. For years and years and years, we used to tell people, nope, get your dog out of the bedroom. This is really bad. And then a few years ago, Mayo released a study saying that people actually sleep better with their dog in the bedroom. So not bed, but in the room, because I suppose it's sort of reassuring and it's kind of nice. And so I thought that was really interesting, that this thing that we've talked about forever is sort of a truism. Wasn't.
Well, and there's the thing that for some reason the media has started focusing on it again this week, even though it's, I think, a 2-year-old study that if it's in the bed, it turns out that women sleep better with dogs than with a partner, which I had no idea. And my wife and I have been in the middle of and I'm sorry to use this term because everybody that's been on the show agrees it's a terrible term. We need to get rid of it. We need to come up with something better. My wife and I have been doing a sleep divorce for 6 months now. And partly because of my 3 o'clock alarm, but partly also because when I went to my sleep lab, I found out that I had a periodic limb movement index of 82.
Jeez.
Imagine sleeping next to that. So, we started doing that. It's done wonders for her sleep, but it also means that the dog comes and sleep with me. So, because
she didn't get the dog?
No, somebody's got to get the short end of the stick, and it's me, because the dog ends up usually at about 1 a.m, having a dream. So I'm lying beside this miniature labradoodle who's going. It's a fun night of slumber.
So the dog's doing kind of what you were doing to your wife.
It's turnabout is fair play, I think, is the message.
I'm smelling karma here.
Yeah, exactly. Okay, so why sleep? Because you have this resume behind you that it just kicks ass and takes names. So why sleep?
So this is kind of funny. So when I did residency, and then I did fellowship, and fellowship is pulmonary, critical care, and sleep. And when you're in your 20s, it's all excitement, right? You're doing all these procedures and it's super fun. And then when I got my first grown-up job, I started seeing, and this was kind of unbelievable to me, we were putting people with like really bad sleep apnea on ventilators, and they were leaving the ICU with tracheostomies.
Whoa.
Yeah. And so I just remember, and it took me a while to figure this out, right? So there's a guy I so vividly remember. He was in the ICU for weeks, and he wound up getting trached. And I would see him out on the medical ward, and he was probably like 35 or 40. And I just pulled up a chair one day and I sat down with him, and I'm like, so what's the deal? Like, really? You wound up in the ICU for like weeks because you have sleep apnea? And he's like, I just couldn't do the mask. And it just was such an epiphany for me that we need to do better by our patients, right? Like, we can't just let them try a mask or two and then be like, patient declined treatment, and kind of write them off. We really need to treat this early, because you can't trach a 35-year-old for sleep apnea that's untreated. It was horrible sleep apnea, and he had bad heart failure from it, and so on and so forth. But I'm like, oh my gosh, you guys, we need to be better at this.
I always liken the mask, because I have very, very mild sleep apnea, and the mask was an option, but it wasn't something that I necessarily needed. It might take me from a 9.5 to a 10 out of 10 on a some sort of sleep scale. So it wasn't something that I absolutely needed to do. And it's good, because I liken some of the masks to being the reason that Darth Vader is so cranky, because no wonder he's upset. He's got this mask stuck to his face all the time. I'd be pissed off most of the time too. So
that's so funny. I describe it as an air compressor strapped to your head.
Yes.
when I'm trying to tell my patients, because I feel guilty, right? Like, they come in, they're like, I'm really sorry. I couldn't do it. And I'm like, I get it. Basically, here you go, sir. Wrap this thing around your head and see you later.
It's only slightly less unusual than your first night in a sleep lab. Here, strap 21 electrodes to your head, wear this belt, wear this thing on your arm, wear these things around your ankles, have a nice sleep. What? And there's a guy going to be watching you on a camera, by the way. Yeah.
Spooky. I know, right? And so that's exactly it. And and then on top of that, you've got this almost like performance anxiety, right? You've waited for however long to get into the lab. It's costing like $2,000, and you're like, okay, I have to sleep. And then you're like, oh my gosh, I can't sleep. And why is this guy looking at me? And these wires are weird. And what does that smell, right?
and what is that stuff he put in my hair?
Yes. And how am I going to get that out? I've got long hair. That's like a significant concern for me. and so no, I get it. And so part of it, when we talk to our patients before testing, we're like, we get that it's not a normal night for you. The stuff like, well, if you have 5 things in your hair versus 10, like, does it really matter? Right? Like, you're getting wired up, and we get that it is weird, and this is the data that we're hoping to achieve, and we get you're not going to sleep like you normally would at home, but let's just see if we can get usable data from this. And I think it kind of lets them diffuse a little bit, because they're like, oh, okay. And like, everybody thinks it's weird. Like, we had a radio personality in our lab who would post pictures on Twitter of him in the lab with all the stuff in his hair, and this is probably 10 years ago. So yeah, for sure it's weird.
Yeah, and the idea that you're going to get a normal night's sleep. I mean, one of the things, and people who listen to the show all the time have heard Mark Boulis from Sunnybrook Hospital in Toronto on the show talking about a website that they put together that is, if you want to look it up, it's psgnorms.com, where it was what the science nerds like to call a meta-analysis of a whole pile of sleep studies that had been done, and then they figured out, okay, if your gender is this and your age range is this, and you can click, options for both of those things, then this is roughly what you should expect to get. This is normal for a person on their first night in a sleep lab. And if you click this button over here, it'll tell you what's normal for your second night in a sleep lab. And it's fascinating to look at, but at the same time, for me, it was concerning because the first night I spent in a sleep lab, I found out that I was spending 1% in N3 or deep sleep, when normal PSG results from your first night in a sleep lab should put someone my age somewhere around 18 to 20%. And that's a less than ideal circumstance. And there I am getting, 1/20th of the sleep that you're supposed to get if you want to have things like your glymphatic system kick in and flush out all the toxins in your brain and all those sorts of things. So this has become a kind of an interesting project for me as I try to talk to more and more people like you and get a better understanding of why everything was so horribly broken. And one of the things I want to pick your brain about, you just came off of a stint as the chair of the Consumer and Clinical Technology Committee for the American Academy of Sleep Medicine. And so you were this person that, if I'm understanding the gig correctly, were kind of on the forefront of the wearables and things like that are out there for people like me who are trying to get better sleep data, but also are trying to avoid going down the road of orthosomnia. Am I right?
Oh my gosh, you've just thrown out so many words that make me so happy, starting with lymphatic and orthosomnia, and oh my gosh, I'm so happy right now.
Oh,
so
good.
You're right. So it's a group of volunteer physicians, and we would meet once a month, and we met for 3 years. In fact, we just had our last committee meeting this week, and then I sort of hand the reins over to the next team. And it was kind of sad. This was such a great group. And so we really dug into this. We evaluated all sorts of sleep technologies, and we tried to do apps and gadgets and websites and, the thing that you wear on your head and the thing under your bed, and really kind of dissect what it is that they do. And so part of it is weighing out, so what does the manufacturer say that they do? And then us looking at the sensors and saying, well, this is what we think it actually does. And so it's been really, really interesting. And of course, we've learned a lot because we definitely took more than our share of left turns in this. But I can see how easy it is to be swayed. So when you look at a device and it says, this is FDA cleared, you're like, oh, okay, this is super robust. But when you break it down, it may just be one component that's FDA cleared, like oximetry. But they're utilizing it to say, hey, we're going to use this to screen for sleep apnea. That hasn't been validated. And so it's really kind of nuanced. And so then we really have to take it back and say, okay, hang on. We can believe the oximetry data, but maybe not the other stuff, right? And so it's been challenging because, right, this is a super competitive industry and their algorithms are proprietary, and it's sort of this whole black box thing that we think this is what's happening in there, but this is kind of what we think we do with the data, but please grain of salt, because there's no transparency or very little transparency.
Okay, so I'll tell you a quick story. I was in, it might have been the insomnia subreddit or the sleep subreddit or something like that, where a guy was claiming that he had stumbled upon the Holy Grail, this will fix your sleep. And according to him, it was forget about bed, sleep on the floor. So my eyes perked up a bit at that, and I said, What are you basing this on? Just so I know this claim that your sleep improved exponentially when you went to sleep on the floor. He says, well, I have this sleep app that's on my phone, And normally what I was doing when I was in the bed is I would put it on the corner of the mattress, and it would read my sleep data and the stages of my sleep and this and that and the other. And he said, just as an experiment one night, I decided to sleep on the floor. And the phone app says I didn't toss and turn. I didn't have, I had the best sleep of my life. And it was because I was sleeping on the floor. That's got to be the answer. And I said, okay, do you think there's a possibility that the thing that rests on your mattress that I guess judges your sleep by how much you're moving around, do you think maybe your floor in your house moves around a little bit less than your mattress?
That's
crickets,
hilarious.
because I had taken this, he had stumbled upon the Holy Grail, and I shot it down because he forgot that basically his app that he was depending on right out of the gate was never going to give him anything even semi-accurate.
Well, isn't that funny? And then the question I always like to ask my patients is, how do you feel in the morning? Based on how you feel, not how Fitbit or whoever says that you felt. And there's definitely a disconnect, right? Like if you pick it up and you're like, oh my gosh, I had 20 awakenings and I didn't have any deep sleep. And oh my gosh, I'm going to, this is horrible. And then you feel horrible. But if you wake up and you're like, I feel pretty good. And then you look at it, you're like, oh, so maybe this isn't actually very accurate and actionable. And maybe I should not pay as much attention to this.
Yeah. It's like the people over in the nutrition world or the weight loss world who will say, oh, I want to lose 20 pounds. Okay, well, I mean, I can go grab a chainsaw and we can take care of the 20 pounds right now. I mean, what do you want to lose 20 pounds of? Well, I want to lose 20 pounds of fat. So how do I lose 20 pounds of fat? Well, there's a specific way you have to go about that. And why do you want to lose 20 pounds of fat? So my clothes will fit better. Okay, so why don't we instead start with how do your clothes fit? What are you in? You're a size 14 and you want to be what, a size 12? Okay, so let's worry about that instead of focusing on an artificial number that we don't really know. And let's focus on how do your clothes fit and how do you feel? And you open that door for people and they're like, oh.
Well, and isn't that funny? Because I really do liken what we've done with sleep to what we've done with weight reduction forever, right? Like everybody wants to have this magic pill and it makes you skinny, right? Like you get the treadmill and that sucker doesn't make you skinny unless you're actually on it. And so by the same token, we're willing to fork over like $200 on a sleep tracker, but we're not willing to put down our phones before we go to bed, right? We're not willing to cut out the caffeine and we're not willing to get up and move. And so it's really funny that people will invest all this money in things to make their sleep better, but they'll completely ignore the free advice. Just like weight loss, right? Eat better, move more. Right.
Well, but that opens up a whole other door, right? And you talk about, someone who's 35 being trached and all these sorts of different things. So many people that have been guests on this show, most recently, Julie Flygar, who wrote a spectacular book about narcolepsy. She talked about the idea that we just need general practitioners to recognize that there are sleep doctors available, because you go to most GPs and complain to them about your weight and they'll say, eat less, exercise more.
Right.
And you'll go to a lot of GPs and you'll say, I'm having trouble sleeping. And they'll say, well, take some melatonin and everything will be fine. And there's this whole other universe that gets unlocked if you are lucky enough to have a doctor that will say, no, you need to go to a sleep lab. That's what you need to do.
Isn't it amazing? She is kind of amazing. I follow her from afar. I just think her story is amazing. She's one of those people that at some point in life I really want to meet. She articulates things so well and gives this perspective that really we haven't necessarily seen before. Right. And so she will, I thought she did a really good job when the FDA had this group of people who had narcolepsy and they're like, hey, what do you want out of these drugs? And of course, everyone's like, yep, I want to feel more awake. But then this idea of mental fog and mental clarity, I thought that was really enlightening, because that is something that people complain about. And we don't really have great medications or treatments for it. And so you're right. I mean, how many people with narcolepsy get diagnosed with something else? instead of narcolepsy, right?
Well, and then there's the whole stigma around narcolepsy to begin with, that until it's diagnosed, people are just like, well, have another coffee. You'll be fine. What's wrong
Or
with you?
even after it's diagnosed. That is such a challenge because they're like, just get more sleep, right? Just go to bed.
Yeah, which is like going to a depressed person and saying, come on, cheer up.
Oh,
What?
my gosh. Isn't that infuriating? Just cheer up. Oh, well, duh, I wish I had thought of that. Brilliant.
So, as we continue these parallels between the nutrition world and the sleep world, here's a comparison that I've made before, that the only, and let's go back to the conversation about body fat for a second. The only 100% accurate test to quantify your percentage of body fat is a procedure called an autopsy. And I don't think that most clinicians would recommend that for a casual weight loss enthusiast. And so as you get further and further away from the accuracy of an autopsy, then there's more and more of that stuff out there, whether it's, getting yourself dunked in the tank of water and seeing how much fat floats, and whether you do the thing with the calipers where they pinch your fat and the various sites around your body, and all these different things that they can do, or the scale that you step on that tells you what your body fat is.
Yeah.
And so all these different things, and all the central question comes back to, why do you need such granularly accurate data? Why do you care if it's 22.1% versus 22.2%? Why do you need that level of accuracy? And I think it's the same in the sleep world, right? I mean, I think the central thing is, okay, if you've got a sleep app that sits beside your pillow, that's great. If you're using your Fitbit, that's great. But whatever the numbers that come back from whatever your devices are, regardless of their level of accuracy, if you've got a concern about your sleep because you're waking up feeling like garbage every day, talk to your doctor and get a reference to a sleep clinic, no?
I agree. And that's just where the whole subjective part comes into it, right? Because it doesn't matter if you have perfect sleep according to your tracker. If you don't feel rested, there's an issue. Right? That's the metric that we need to focus on, not the number of breath holding spells you have on your CPAP and not all this other stuff. It's how do you feel? And does it make sense based on what we're seeing, or do we need to look for something else in there?
Interesting. And yeah. And you're right. The advice is out there and it's free. And instead, so many people are content to talk to Dr. Reddit, or talk to Dr. Google, and talk to, Mr. Bojangles 732 on Reddit, who says, oh, what you got to get is this special strain of marijuana, and then you smoke a bowl about an hour and a half before you go to bed. You'll sleep like a baby. Works for me, and it's got to work for everybody. Well, no.
You know what I do love, though? Sometimes it's that random conversation in the grocery store. Like somebody will be at the checkout, pre-COVID, right? And for some reason, they're complaining about their CPAP. And some random person will say, just stick with it. You'll be fine, And that I've had because I have patients that evangelize about like CPAP and sleep and all of these things. And sometimes it's that random conversation in the grocery store that makes somebody decide that, oh, well, maybe it doesn't suck so much. And, oh, there's somebody that understands and they're giving me hope. Because I think there's sort of this assumption that if you're in a sleep clinic, they're trying to sell you something, right? Like, we want you to wear a CPAP because we make $1 million off of each one,
right.
And the reality is I don't sell CPAP.
Right.
Like, I don't care how we treat your sleep apnea as long as we treat it, right? If you want to do weight loss or a dental device or a nasal EPAP device that you put, in your nose, whatever, I don't care. We're good as long as we treat it.
Right, exactly. I'm going to throw a sentence out, and keep in mind that among the key words in the sentence that I'm going to throw out are pre-COVID, and I like the way you said that, pre-COVID. That's a term I'm going to use going forward. So I'm going to say this and tell me if you think I'm crazy. Pre-COVID, I think a lot of people were starting to latch onto the idea that sleep might be getting attention as the next big global health crisis. And I'll underline pre-COVID. Am I close?
I think you are. CDC put something out a year or two ago calling it this sort of epidemic or whatever terminology they use, but they put it right there on their CDC website. and they see this as a problem, right? So it's more than just school start times, although that's part of it. It's this idea that we are chronically sleep deprived. So a friend of mine is doing research on this post-COVID. And she's asking people to put in, like, when you go to bed, when are you waking up, how much sleep are you getting? And what she's seeing is that people are sleeping in and getting more sleep. I was listening to something, it might have been on your podcast, I don't even remember now, but they talked about how viewership for TV between 6 and 8 a.m. decreased.
Yeah, Michael Grandner and I talked about that a few episodes ago, where early morning television watching has plummeted, but late night TV viewing, like between 11 at night and 2 in the morning, is through the roof. And so if you want to use that as one example, then, I mean, by that metric, it would suggest, people are sleeping in and staying up late.
Well, and I think it's so funny because, forever I have always kind of been like a 9-hour sleeper. And I've always had this sort of delayed sleep phase tendency where I do kind of like to stay up and I would love to sleep in. And a friend of mine who is a sleep doc in Atlanta, we both joke how we have this delayed sleep phase syndrome. So when we travel to sleep conferences like in Seattle, we are super excited. But when we go to like Tampa, we're both like, oh my gosh, it's so early. And of course, I've got a friend of mine who is a complete morning person, and he jokes that he has ADHD. So he would have conferences start at like 7. And so then my other friend and I are bleary-eyed, and we're getting there, and we're trying to get everything ready for this conference to go off really smoothly. And he bounces in. He's already had a workout. He's already had a shower. Like, he's just like ready to tackle the day. And my other friend and I just kind of look at each other. We're like, oh man, I'm so jealous. I wish I could do that. Right.
I look at those people. I'm the same way with naps. I look at people who can bust out I'm just going to take a half-hour nap. Really? I hate you with the fire of 1,000 suns that you can take a half, because for me, it takes me an hour. Here, I'll look. I'm going to actually, as we sit here, I'm going to punch up the info from my Fitbit from last night. And this will give you an idea of the hill that I am trying to climb. So last night I was in bed, I want to say by 9 o'clock, maybe 9:30. And it was one of those tossy-turny nights, even though my handy-dandy bottle of Mirapex for the restless leg and the periodic limb movement was failing me. It was around midnight that I got up and had like among the tiniest bowls imaginable of Cheerios, just because I didn't want the stomach grumbling to be the thing that was going to keep me awake next. And so my Fitbit tells me that even though I went to bed at about 9:30, it was 2 o'clock in the morning before I actually fell asleep. So combine that with these people who say, I'm going to take a half an hour nap. It takes me an hour and something sometimes just to fall asleep, much less the idea of having a half an hour nap. That's not even on the radar for me. And so it's this, figuring out what the next step is, even just to get a normal night's sleep, never mind become a person who, if I decide I need a nap, I can take one. Are you a napper?
I'm not. And it sounds like you have a little sleep envy.
I have a lot of sleep envy. It's among the issues I have, Seema. So many issues.
Well, and it's so funny because I think a lot of people that we see in clinic, I think that they do have a lot of sleep envy just because their bed partner falls asleep really quickly. And then they're like, oh my gosh, why can't I do that? And part of it is expectations, right? Like if you fall asleep in 2 minutes, that probably means that you're chronically sleep deprived. And that's not normal. I mean, we like it, right? Because we want to be efficient and we don't want to waste all this time awake when we could be asleep. But realistically, it should probably be like 15 minutes or 20 minutes to fall asleep. And so then you've got patients when they fall asleep in 15, 20 minutes because they're comparing themselves to their partner that is asleep before their head hits the pillow. They're like, I need Ambien. I'm not sleeping well.
And then you go down that whole road, right?
Well, and then you kind of have to reframe, right? Like, what are you expecting? Like, what is your expectation? Because, sleep is, I think it's this great equalizer, right? Like, it doesn't matter who you are. If you're wealthy, if you're not, it doesn't matter. We all need to sleep.
Well, if you go back to the second episode of this show, I was lucky enough to sit down with Dr. Adrian Owen. And at the time, they had recently released this meta-analysis and this work that they had done with people who would do cognition tests and also report on their sleep. And what they discovered was that people who sleep, I believe it was less than, normally get less than 6 hours of sleep a night, were functioning from a cognitive perspective the same level as someone who is 9 to 10 years older than they are. But they also, surprisingly, found that that was similarly true of people who were getting more than 10 hours of sleep every night. So there's this sweet spot for everyone where cognition is concerned. And he and I sort of painted this picture of this hard-charging type A personality, top of the world, wins all the sales awards, blah, 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 blah. And he's getting by on 6 hours a night. And we talked about this idea that he might have an entirely different awesome level of performance that he doesn't even realize he's got available to him because he doesn't feel sleepy. And all he's got to do is grab maybe an extra hour of decent quality sleep, and he unlocks this door to a whole other level of achievement. Isn't
that so true? I've said that to a few, and you're right. They're the sort of executives that sleep 4 or 5 hours and they're super productive, and, they're in clinic because they had like their executive physical at Mayo and they were worried about sleep apnea or something like that. And they're super dismissive, right? They're like, I'm fine. And then when you mention to them, imagine like this is your level of productivity now. Imagine unleashing this additional, bonus level of what you could accomplish. And that kind of makes them take pause. And they're like, right? They always thought that they were performing at the top of their game, and maybe there's more to it. Maybe there's more potential. And then they're like, oh, okay, maybe I'll pay attention to this.
Well, and when we use the phrase game, it's interesting too, because and I want to get into your new podcast, but the first guest on your first episode of your podcast was Dr. Chris Winter, who does a lot of work with professional athletes and just, garden variety athletes. And it's been interesting where in the last year or two, you've got all these superstars in football and baseball and all these other sports that are walking around going, no, the thing that puts me at my peak is that I get the proper amount of rest.
Isn't it fantastic? I'm actually super, super excited about people paying attention to their sleep. It feels like forever we've been screaming into this void. And now all of a sudden, people are listening. And I'm completely guilty of it myself. So when I was an intern, I was, you work these crazy hours. And I remember driving home and I fell asleep at a stop sign.
Oh.
Yeah. And so the guy behind me had to, beep his horn to get me going. And my immediate thought was, oh, I'm such a good little intern. Look at me. I worked so hard. I fell asleep at a stop sign. Yeah. And it took me an embarrassingly long time to realize that that's not so good. Right? Bad move. Yeah. And so, but it's so ingrained in our culture. And so I see this almost cultural shift in acceptance of where now people are on Instagram talking about like, this is my sleep mask and I'm going to bed early. And I'm like, oh, this is wonderful. I love that people are talking about their sleep.
And like you said before, and I'll invoke it again here, the advice is free, right? There's 500,000 articles every week written about basically it's a rehashing of sleep hygiene.
Exactly, give or take, right?
Right? And they're all out there. And I mean, decorating websites are publishing stories about sleep hygiene. Decorate your bedroom this way. Oh, and by the way, don't put a TV in the bedroom, blah, blah, all this stuff that's designed to get people to get their sleep game in order. But apparently we're just resistant to that whole idea. And Michael Grandner made an excellent point a couple of episodes ago that so much of what is broken about people's sleep is stuff that we have chosen to put there, whether it's our devices, whether it's watching the latest rundown of the numbers about COVID-19 on the 11 o'clock news and then turning it off and going to bed and just lying there fretting about the numbers for half an hour. So much of it is just stuff that we have consciously chosen to introduce into our sleep lives.
And yet we're so resistant to that idea that somehow this is a consequence of the action I've taken. And the answer's got to be something outside of that, outside of the choices I'm making, right? There's got to be something wrong with my sleep.
So one of the choices that people can make is to listen to your brand new show. Talk to me about Talking Sleep, which by the way, I love the title. I was interested when I looked at the logo because I was convinced that the words "in your" were going to be in there in tiny type somewhere, so it was talking in your sleep. But Talking Sleep is brand new. Talk to me about what it's for, because I get a sense that you and I, while we're batting around a lot of the same subjects, we're talking to two very different groups of people.
So you're right. I mean, this has been kind of exciting. This is an AASM podcast, so meaning they do all the heavy lifting. And so we are hoping to just talk about different facets of sleep. So not just the things within the AASM orbit, right? Because I think we see a lot of that already, but really pulling in people from, like research and industry, and really having this robust conversation about sleep. And you're right, we are sort of geared toward sleep physicians and clinicians and that sort of thing. But I feel like a lot of the messaging is digestible. And so I'm really hoping that this will maybe spill into not just clinicians listening to it. I really hope it'll help us engage in a great conversation about sleep.
Yeah, because the answers are, unless it is a serious medical condition, but even those are treatable. And you talk about finding better ways than just giving up on somebody wearing a mask after a couple of different tries. The answers, one would think, are pretty easy to come by. And I think the more people are talking about it, this was the first thing, because someone pointed out your podcast to me the day it launched, and they said, well, now you're in trouble because you were having your little podcast cranking along, and then all of a sudden the American Academy of Sleep Medicine starts a podcast. I guess you might as well shut yours down. And I went, no. Because the more people that are talking about this, the better, for starters. You're right. I think at first blush, I felt like yours really is finding a home among the clinicians. But you're right. There is so much room for your show in particular to sort of also appeal to the masses. I love the idea that there are just plain more people talking about it. And I think the more of us get to, it's like somebody somewhere will find a way to write the article about sleep hygiene that will appeal to the people that haven't been reached yet. I don't know who that person's going to be, but so there's probably going to be an article about sleep hygiene in Construction Worker Monthly or Field and Stream or something like that that's going to reach these audiences that otherwise people like you and I are never going to have a chance of talking to, simply by virtue of finding a way to appeal to those audiences, Yeah,
and I think that's exactly it. I think you kind of have to meet people where they are. So, like 100 years ago when I did pulmonary, you could never really talk to people about quitting smoking with you're going to get lung cancer and die. You would kind of have to maybe choose something that you thought was personally important to them. So I just remember this one woman, we talked about how the smoke causes wrinkles around your lips.
Sure. And
she just gave me this look of like, her eyes got wide. She's like, does it really? I'm like, it kind of does. And it's really bad for your skin. And she's like, oh my gosh, I need to quit.
Yeah.
So like she didn't care, right, about the COPD and the lung cancer and all of that. She's like, oh, but my skin. And it's legitimate, right? Like I think it was Estee Lauder. I can't remember which company, but one of these companies a few years ago did a study on sleep and skin. And they had these experts look at skin, and they had some sort of device that measured skin tone and wrinkle depth. And what they found at the conclusion of the study is if you slept better, you appeared more youthful.
Wow.
Very powerful, right?
Yep. And look, vanity to a certain degree is part of everybody's experience. And if that's what it's going to take to get you to pay attention to your sleep, then yay. Thanks for finding it.
I agree. Just like the weight loss data and all of that. I mean, what else can you do where you literally just lay there, right? And you feel so much better afterwards.
Yeah, exactly. Okay, so for your show, talk to me about how it's going to work, because episode 1 is out. It's you and Chris Winter. When's episode 2 happen? How often are the episodes, and where do we find them, and all of that good stuff?
Well, it's so funny that you ask. I'm not sure. So we have 4 that are currently being, I suppose, they're in production. Maybe everything's been recorded, and then they will launch those. And a lot of those were our education. So the AASM has a lot of committees, and these committees are comprised of sleep physicians that volunteer their time. And so one of these committees was an educational committee, and they started producing these interviews with these people in sleep. And so we're going to highlight those in the next 4 episodes. And then we'll really start into other interviews with people outside of the AASM, for example, or really, I'm sure we'll have a lot more on COVID. Because this is really, I mean, it has devastated a lot of medical practices, inside and outside of the sleep world.
Sure.
And so, right, we're all having to kind of, look at our practices with a critical eye and pay attention to what we're doing and what we want to do. Like, what does our future look like? Right. And so I think there's going to be a lot of conversation about that. A lot of it is, like I told you before, that I am really excited to learn from you. Right. Because
which is a terrifying thought.
No, I mean, we are trying to figure it out. Right? Like, what is it that people are interested in? What do they want to listen to? How should we do it? Right? Like, how many episodes should we have? There's a sweet spot, right, between overwhelming people and creating so much content that no one's going to listen to it, and then not having enough where people lose interest.
The idea that I might be the template for anything is horrifying to anyone. Listen, I feel like you and I could probably sit here and bat around sleep for another hour. And I feel like it's certainly a thing that we should look at reconvening, down the road. Because as you say, if you've got episodes in the can right now, as they say, that are just waiting to be released, and then as you continue to go forward and sort of find your footing and all those sorts of things, I mean, I'll be eagerly watching from the sidelines, but I feel like when that time comes, I would love to get you back on and talk more about all of this stuff, because there are so many places to go and so many different aspects of this that we can cover. And I'm excited to hear somebody else talking about it too.
Oh, I'm excited. And then, of course, when we actually kind of get things up and rolling, we'll have to have you, on and share your expertise and your viewpoints.
Because you want to see what the low end of the scale is like in terms of listenership. I think that's a good idea.
Not at all.
Like, here's what's the worst case scenario? How few people are going to listen to this? Let's get Headley on. How about that?
Well, no, I'm waiting for you to shoot me a text and be like, oh, yeah, bad move. Don't do that. No, I mean, that first episode, and you knocked it out of the park with Chris Winter as your first guest too, because I could sit and listen to Chris Winter read the side of a bottle of Ambien and be riveted for 25 minutes. He's spectacular, and Isn't
so
he
a terrific.
Great?
Yeah, I'm eager to get him on this show, but very wisely, he's been hesitant to check his direct messages on Twitter. So I think that's a credit to Chris. But one of these days, whether he knows it or not, he and I will be friends, and he will be here at some point.
I totally got him on Twitter.
Yeah, I mean, well, and he's well worth the follow too.
Yep.
He's a fascinating guy and does a lot of work with a lot of people, like we talked about before, who are recognizing the importance of sleep, and it's to a whole population that probably hasn't taken sleep seriously enough. Where, oh, really? Tom Glavine, the Cy Young Award-winning Hall of Fame pitcher, is a big sleep advocate. Wow, maybe I should be working on sleep because I love Tom Glavine. Those kind of people. I think the fact that he does work with so many of those kinds of people might be the thing that helps get that conversation started with a population that might not pay attention otherwise. But again, and it's the same thing about your show, and the more people that are talking about it, the better for everybody, because somebody will find that way of wording something that will resonate with a crowd that hasn't heard it yet.
Right, and then we all win, don't we? When people take better care of their sleep.
I appreciate the time, and we'll do this again if you're willing. I can't thank you enough for making room for this.
No, I really appreciate the opportunity. Thank you. It was lovely.
And just so everybody knows, where do we go and find your podcast other than, hey, it's available in your podcast app, because hitting a search in your podcast app is normally fraught with danger because you never know what you're going to get back.
We actually have a link on the AASM website. It's aasm.org, and an email was sent out to AASM members. So if you're not a member, I would encourage you to go to the website and click on the link, or you can search for it in the Apple Podcast Store.
There you go. And it's called Talking Sleep. And Seema, you did a great job on the first episode. I can't wait to hear what's coming. You said there's 4 in the can. I'm excited to hear those come out and excited to hear where it goes.
Well, thank you. Now I've learned a new term too, in the can. I'll have to implement that immediately.
Well, and just for you, I'm going to get ready to do the outro. So thank you so much for the time. I really appreciate it.
Awesome. Thanks so much.
There you go, Dr. Seema Khosla on the Snooze Button podcast. You can find everything about her new show, Talking Sleep, at aasm.org. There's a link right there that will take you to her podcast called Talking Sleep. I'm excited to hear what the rest of the episodes bring. A reminder of what we said at the very beginning of the show, Julie Flygar's book, up for grabs. You got to get your entry in before May the 31st. Details on how to do that at thesnoozebutton.com. You click the contests link and Bob's your uncle. While you're there, you can also leave us your feedback on the show. You can click a link that'll take you somewhere where you can rate and review the show. You can get to our social media profiles. You can even donate if you want to the show to help keep it commercial free. Also, if you're liking the content but you're short for time, there's a 9-minute highlight version, basically, of every episode with a different podcast called The Snooze Button Express. And you can also get to that from our homepage at thesnoozebutton.com. Till we get together next week, my name's Neil Headley. Hey, get some sleep, would you?